हाय फ्रेंड्स, गुड इवनिंग एंड वेलकम टू माय चैनल। फ्रेंड्स, इसी वीडियो में आज हम देखेंगे क्वेश्चंस फॉर CHO एग्जाम प्रिपरेशन, ऑल्सो फॉर MLHP एग्ज़ाम एंड ऑल्सो फॉर MLSP एग्ज़ाम। ANM GNM जो वैकेंसी अभी निकला है उसके लिए भी यूज़फुल है। फर्स्ट क्वेश्चन, among the agent used for hand hygiene most effective is option A chlorhexidine based hand rub, option B alcohol based hand rub, option C providonidine based hand rub, and option D all of this. Which is most effective hand hygienic agent? Correct answer is option B alcohol based hand rub. All previous question papers questions. Next question, the main aim of Janani Suraksha Yojana is option A to provide medicine, option B to provide pension to widow women, option C to reduce maternal and neonatal mortality, option D to encourage safe sexual relationship. Correct answer is option C to reduce maternal and neonatal mortality rate. Question, the main aim of Janani Suraksha Yojana. Next question, what is the storage temperature of fresh frozen plasma? Option A 1 to 6 degrees Celsius, option B 20 to 24 degrees Celsius, option C less than 18 degrees Celsius, option D greater than 18 degrees Celsius. फ्रेश फ्रोजन प्लाज्मा का स्टोरेज टेम्परेचर कितना है? करेक्ट आंसर इज ऑप्शन सी लेस देन 18 डिग्री सेल्सियस. Next question, during pregnancy the average weight gain is options 12 to 13 kg, option B 15 to 16 kg, option C 16 to 17 kg, option D 17 to 29 kg. Correct answer, right answer 12 to 13 kg. Option A is the correct answer. Usually 11 to 12 kg, here 12 to 13 is there. That is the correct answer, option A. Next question, specimen record for the diagnosis of swine flu is option A blood, option B urine, option C stool, option D throat swab. Correct answer is option D throat swab. Specimen record for diagnosis of swine flu is throat swab. Option D is the correct answer. Next question, following are the vector-borne disease except which is not a vector-borne disease? Option A malaria, option B dengue, option C typhoid, option D chikungunya. Okay, correct answer is option C typhoid. Remaining malaria, dengue and chikungunya are transmitted by mosquito. Okay. The next question, what is the major birth defect in India? Options, option A congenital heart disease, option B Down syndrome, option C cleft lip, and option D all of this. Which among the following is one of the major birth defect in India is congenital heart disease? Option A is the correct answer. Move on to next question. Which country did Florence Nightingale trained in nursing? Options, option A Belgium, option B United States, option C Germany, and option D England. And the correct answer is option C Germany. अगला क्वेश्चन, जोन्स क्राइटेरिया हेल्प्स इन डायग्नोसिस ऑफ option A infective endocarditis, option B rheumatic fever, option C congestive heart failure, option D congenital heart disease. Jones criteria helps for the diagnosis of rheumatic fever. Option B is the correct answer. Move on to next question. Pink frothy sputum is the clinical manifestation of pink frothy sputum. Option A myocardial infarction, option B angina pectoris, option C pulmonary edema, option D pneumonia. Correct answer is option C pulmonary edema. अगला क्वेश्चन, ड्रग यूज्ड टू ट्रीट ब्रेडिकार्डिया इज ऑप्शन ए एट्रोपिन, ऑप्शन बी एड्रेनालिन, ऑप्शन सी स्ट्रेप्टोकाइनेस and option D aspirin. Among this, which drug is used to treat bradycardia? Correct answer Option A, atropine. The next question, the specific cardiac marker for myocardial infarction. Options, option A, troponin, option B, SGPT, option C, SGOT, option D, C-reactive protein, CRP. And the correct answer is option A, troponin. अगला question, an alternative method of feeding through stomach is called. Option A, gastrostomy, option B, colostomy, option C, ileostomy, option D, all of this. Alternative method of feeding through stomach is known as gastrostomy. Option A is the correct answer. Next question. An organism closely associated with gastric and duodenal ulcer is. Option A, Streptococci, option B, Staphylococcus, option C, Helicobacter pylori, and option D, all of this. Gastric and duodenal ulcer. Causative organism of this peptic ulcer is Helicobacter pylori. Option C is the correct answer. The next question, senile dementia occurs during. Option A, childhood, option B, teenager, option C, adulthood, option D, old age. Senile dementia is occur in old age. Option D is the correct answer. अगला question, tetany is a classical findings of. Option A, hypocalcemia, option B, hypokalemia, option C, hyperkalemia, and option D, hypercalcemia. Tetany is the classical symptom of hypocalcemia. Option A is the correct answer. The next question, basic emotional task for an infant is. Option A, trust, option B, independence, option C, identification, option D, industry. The basic emotional task for an infant is option A, trust. The next question, test performed before arterial puncture is. Option A, Allen's test, option B, Weber's test, option C, Rinnan's test, option D, Cole test. Test performed before arterial puncture is option A, Allen's test. The next question, first line drug for patient with type 2 diabetes mellitus and obesity is. Option A, sulfonylurea, option B, metformin, option C, insulin, and option D, all of this. The first line drug for patient with DM, type 2 DM and obesity is metformin. Option B is the correct answer. Next question, sweat chloride test is used to evaluate. Option A, tuberculosis, option B, leprosy, option C, cystic fibrosis, and option D, bronchitis. Sweat chloride test is for cystic fibrosis. Option C is the correct answer. The next question, tachypnea in infant means. Option A, respiratory rate 60 per minute, option B, respiratory rate 50 per minute, option C, respiratory rate 30 per minute, and option D, respiratory rate 20 per minute. Tachypnea means increased respiratory rate. Here correct answer is option B, respiratory rate 50 per minute. The normal respiratory rate is in infant is 20 to 40 per minute. So if it is above 40 means it is tachypnea. And the next question, indication of flexible fiberoptic bronchoscopy is. Option A, atelectasis, option B, persistent pneumonia, option C, unexplained hemoptysis, and option D, all of this. Correct answer is option D, all of this. Bronchoscopy is the visualization of tracheobronchotree. Okay, here indication of flexible bronchoscopy is for atelectasis, persistent pneumonia, or unexplained hemoptysis. In all cases, we can do this flexible fiberoptic bronchoscopy. Option D is the correct answer.